Hi, this is Dr. Matt Lawless bringing you another knee moment from Knee Fit and 5 and MSM products. So I've had a lot of people ask me about how do they know if they have a medial meniscus tear. And interestingly enough, Scott from physical therapy started talking about his knee pain and how he had medial sided knee pain. So I said, well, that's interesting. Maybe we can do a video of how I would find somebody in the office and do an exam and a history on them and find out if they have a meniscus tear or not. So that's what we're going to do today. We're going to see if Scott really has a medial meniscus tear. Hey, Scott.
Hi.
So, Scott, where does your knee hurt?
It's right on the inside of my knee, right in this area and here.
And how long has it been hurting?
Probably for a couple of weeks now. It seems to be kind of on and off. Some days it's worse than other days. Even some days I feel like it might even be gone, and then the next day it's right back the way it was the few days prior to that.
Was there any trauma or injury to it?
No, not that I'm aware of.
So it just kind of started?
Yeah.
When does it hurt the most?
There's several things that I've noticed. One thing is if I pivot on it. If my foot's planted and I pivot on it, that's painful in that area. If I accidentally bump into something, like maybe I kick a ball or I kick the leg of a chair or something like that, there's a sharp pain there. If I've been sitting for a while and I get up and my first few steps, it makes me want to limp because it's painful there. But even when I sleep, I've found that I have to put a pillow in between my knees because it's painful there. It wakes me up.
Interesting. So right now in my mind, I'm thinking what would be on the differential diagnosis or what else could it be? And Scott is, what he's told so far is pretty concerning for a medial meniscus tear. I say medial meniscus tear because, again, a refresher, the medial aspect's the inside of your knee and a lateral aspect over here. And as the knee model shows, you have a meniscus on the inside and the outside. And it's far more common to have a tear on the inside, which Scott is trying to describe or tell us that that's what he has. Is there anything that makes it better?
I've tried to ice it and compress it and elevate it, the typical rice method of just trying to get some of the swelling out of it, and that seems to help temporarily, but then it comes back.
Gotcha. Okay. So to start the exam, I've already seen Scott walk, and his gait is pretty normal. We've already gone through some squatting and some single leg squatting, and he has pretty symmetric leg strength. So throughout these last few weeks, as this has been hurting, I would say good job to Scott for keeping his legs strong. If you liked this video and found it informative and would like to have further information, please check out our YouTube channel as we have many informative videos there. Please also subscribe to our video channel and you'll get weekly updates with new information.